Well, thank you, everybody. This is Steve Lucas at CLPHA. We are in the home stretch of our conference. A lot of familiar names in the participant list here, so thank you for joining us for this session. I just have to say, I'm really excited for this presentation. Our colleagues at SAHF, they feel like kindred spirits in a lot of ways. Similar sized organization. We have, I think, similar philosophies about cross-sector work, and it's great to have sort of a peer organization, that we can lean on and collaborate with. They've been doing some really exciting work that they're going to talk about today, but I just want to do a couple quick housekeeping reminders. Everybody is in listen-only mode, and I have to unmute you if you want to be unmuted, or Kirsten, my colleague at CLPHA, who's helping run the session. But we had to take some extra security measures after this morning's plenary, so thank you for bearing with us. It seems like everyone got into the session okay eventually. But with that, I'm going to hand it over to Alexandra to kick us off today and enjoy this session.
Thanks so much, Steve. So good afternoon, everyone. Welcome. So we had a few technical glitches. I am doing this by my phone, so bear with us if there are a couple transitional things that we need to work out as we're going. But we are thrilled to be talking to all of you about operationalizing resident-centered values and facilitating resident agency and voice. As I think people are getting led into the room, we wanted to ask everyone to take a minute and just enter into the chat box. Tell us why you selected the session, what drew you to it, what are you hoping to gain out of it? And I think my colleague Sandra is going to monitor that since I have limited visibility in the phone version of the app. But again, I'm Alexandra Nassau-Brownstone. I'm the Director of Resident Outcomes and Cores at Stewards of Affordable Housing for the Future. I'm joined by two colleagues, Sandra Serna, who's our VP of Health and Housing, who many of you may have gotten to meet yesterday. She was on one of the panels talking about an exciting new initiative with United Health Group. And Elizabeth Gonzalez Suarez is the Vice President of Community Life at the Community Builders, which is one of SAFE's member organizations. I also wanted to take just a quick moment and give you a sense of the structure for today. Sandra and I are going to talk about some of SAFE's work in this space. And then Elizabeth's going to share her perspective and the Community Builders' perspective and framing to talk about it from a practitioner's perspective. We welcome questions and comments in the chat box. We're likely going to hold most of the answers to questions until we get through the presentation, and then we'll have an opportunity to go back through the chat box and answer any questions that came up on either presentation. Depending on how many people we get to join us today, we may have the opportunity to unmute you if you want to raise your hand and ask a question as well. After Q&A, we are going to split the group up into 3 breakout sessions. We're hoping this gives everyone an opportunity to have some discussion and some peer exchange about all of your work in the space. Before we went virtual, that was really the intention, was to not only share what we're doing, but to provide a forum so that we can learn from all of you, and there's an opportunity for sharing as we're all working towards this goal together. I think we can go to next slide. So while Sandra's doing that, for those of you who are not familiar with SAFE, SAFE is a collaborative of 13 high-performing multi-state nonprofit affordable housing owners. We own and operate more than 140,000 affordable rental homes. SAFE's members came together to promote a series of shared ownership objectives, embracing that affordable, service-enriched housing is critically important in the lives of all people and can provide a really strong platform for both housing stability and economic mobility. Over the past 17 years, our areas of work have grown beyond policy, but also include energy and water conservation and sustainability, our resident outcomes collection and housing as a platform work, our work at the intersections of health and housing, and more recently, our core certification, which recognizes an organization's capacity to do resident services from a systems approach. But today, we're here to talk about our collective commitment to better integrating and making real the resident-centered values and strategies that we all have, and building it into the business of our resident services and our operations of housing. About 5 years ago, SAHF formed a community of practice to support a system of enhanced resident services coordination. We went through significant engagement of various stakeholders in the housing world, in the healthcare and public health space, in social service and education. And that led to the development and publishing of this framework in 2018. This framework, this graphic element, goes with an additional component, which is available for download through the CLPHA app, of a full set of guidelines that go with this. But it's really a decision-making framework, how an organization thinks about when and where and how they're going to provide services in their portfolio in a way that you can replicate and scale, but also is reflective of the unique needs and opportunities of the communities in which we all serve. As you can see, residents are at the center of this graphic and of this tool. And it's really articulated as a value. But as we've gotten further into this work and engaged more deeply with practitioners across the field, there really is a challenge that we all face in operationalizing this in the daily business, both of managing the real estate, running services, collecting data, reporting to investors and lenders. In addition to that, SAHF also published a toolkit, A Culture of Caring, back in 2018, which was a compendium of tools and workforce principles designed to support better well-being for frontline staff in affordable housing. So the development of both this framework and that compendium, that collaborative work has really moved us upstream to start to identify opportunities for mitigating the impacts of toxic stress and trauma for residents in housing communities, and to work for greater well-being for the industry staff. And it drove us further down this path to thinking about how person-centered values get integrated and operationalized in our work. We can go to the next slide. There is a growing body of evidence that validates the role of agency and sense of control in a person's well-being. Both traditional healthcare and public health experts are seeking to implement person-centered approaches to outreach and care and measurement. The evidence demonstrates that perceived control plays a role in mitigating trauma and toxic stress, especially as it relates to this present moment and thinking about future. For seniors, the declining physical health can also have an impact on sense of agency and control, and with opportunities to augment and create opportunities for increased voice and agency, this can have a significant impact on their engagement and reducing their social isolation. The U.S. Partnership on Mobility from Poverty, run by the Urban Institute, also identified 3 pillars that they see as being essential for economic mobility. In addition to economic success itself, the feelings of power and autonomy and being valued in the community are critical. I was also struck this morning by Jeannie's comment in the morning plenary. She said, equity happens at the moment of choice. And she asked us to reflect on that. And I felt this resonated really deeply in our work and our experience in talking with residents and staff. It's especially nascent right now, explicit in this moment we're all in. The health and economic and social implications of COVID, the socioeconomic and racial inequities that are highlighted by COVID, and the movement across the country demanding equity, demanding greater choice and greater voice, both in our policies and in our daily lives. You can go to next slide. We also wanted to share as context an example of a framework that we looked at while we were engaged in this work. There are a number of different frameworks around community engagement and public participation. This one was developed by the International Association of Public Participation, and it lays out a fairly linear spectrum of understanding this, beginning with informing, which is where we're making decisions as owners and practitioners and communicating those to the residents, all the way to empowerment, which is a much more collaborative approach and infrastructure. We've begun thinking about how we take that framework that was in the earlier slide and integrating this into that. A number of our member organizations have begun that too. One of them, Mercy Housing, has been undergoing a strategic planning initiative and visioning session where they've identified resident voice as their North Star. And they used a version of this framework and sort of mapped out their own policies and procedures and values along this, which is a really interesting way of thinking about it. So this gives you some of the background and the context for how SAHF entered and continues down this path in this work, but I'm going to pass it over to Sandra, who's going to talk about a project that SAHF has been engaged in over the last year, in which we talked with residents and frontline staff and some senior level staff to better understand how we do a better job as resident services practitioners and housing owners and stewards, really, to create policies and practices that do a better job of turning these values into practice in our work.
Great, thank you, Alexandra. So, as Alexandra indicated, SAHF is currently undergoing a Fostering Resident Agency and Voice in Affordable Housing initiative, which is funded by the Kresge Foundation. The bulk of this work started last year, and it had the explicit goals of engaging directly with residents, frontline staff, and corporate level staff to understand perceptions of resident voice, power, and engagement. So understanding a resident's hopes and dreams and how potentially the property and service-enriched housing can lift those hopes and dreams and assist residents with reaching those. Also understanding the value of resident data collection and what are the opportunities that property owners have with sharing data back with residents, and how do residents feel about being asked all this information. We also tried to get information on what residents thought about how they're supported for health and well-being, particularly on mental health. We asked explicitly about trauma, and if they had any perceptions or responses to a trauma-informed approach, which incidentally we found, not unsurprisingly, that even titling it a trauma-informed approach is a little too academic. So, even then, we've heard throughout this conference how communication and vocabulary matters, but how can we really get to the core and understand how to apply these trauma-informed approaches in a way that meets folks' needs without stigmatizing them. And so obviously through these touch points, we wanted to understand what are some potential opportunities and strategies for resident engagement beyond just making sure that they're engaged in programs at a property and giving them true partnership to allow them to exercise their voice and power. And as such, through our analysis, which we're currently conducting, we want to understand where good intentions and a resident-centered values or missions could potentially break down in your day-to-day operations. It's a really challenging line to follow, and how can we best come up with solutions in practice to have more property owners make that shift if they so choose, or as we would like to encourage. And as Alexandra already mentioned, our findings, we hope to incorporate them into our guidelines for a system of resident services coordination. A little bit about our methodology. So we conducted 6 focus groups in 3 different locations with a total of 58 residents participating. Focus groups were actually conducted with our partners at Success Measures. Success Measures also assisted us with developing the instruments for the focus group. We contributed heavily to that, as well as the interview instrument, providing feedback. The location of the focus groups and which properties we went to represented a wide swath of geography, resident demographics, and were also selected to ensure that a full-time resident services staff presence was available. Of the 6 groups, half, so 3 of those groups, included just seniors, whereas the other half were of mixed ages, with 1 of the remaining 3 specifically for families or parents. And then we continued on with the interviews, interviewing all the resident services coordinators and property managers for each of the sites. We conducted the focus groups, as well as the corresponding senior resident services staff members from all 3 organizations. So some of the learnings we gathered, and these learnings are explicitly from the focus groups in particular, was that when we asked residents what they liked best about the property, far and away, it was how the property allowed them to make connections to people. So it was the community that's within the property themselves, how they are able to connect with their neighbors, proximity to their family and institutions that are important to them in the larger community, as well as having supportive relationships with property staff. That far and away was what they valued most out of living where they lived.
And I would add to that, Sandra, that was absolutely the most valuable top priority, which is not to say that the physical amenities and location were not listed. Those were important, but the connection to people really struck us as being paramount for everybody. In addition, residents talked about the value of resident services coordinators, and talked about the relationship to those people, but they talked about the importance of the social environment broadly at the property and the importance of relationship-oriented staff. And that was expressed with both positive examples on, resident services, management, maintenance staff, and also the negative examples of that when they felt that there was a person on the staff who, for whatever reason, this was their language, relationship-oriented. They felt that they wanted people who wanted to engage with them, that felt that there was a sense of community.
Absolutely. And in line with the social environment being so key to resident satisfaction, the access to common spaces and amenities was really important in that. What we found was that in instances where unfettered access to such common spaces were uneven, it made residents feel like their house, where they live is not really their home. And in truth, the ability to commune in these spaces, whether it be, outdoor spaces with a grill or more of a kitchen, cafeteria-like space, they felt that when they were able of their own free will to gather and commune in these spaces, it facilitated community building and safety and connection to their neighbors. There was something about having to essentially ask permission that really dampened that effect and dampened them feeling that they had a voice in what could occur on the grounds of their home.
Yeah, and I agree, and I would add to that, this is one of those places where as owners, we, in the pre-development, the development process, we spend so much time frequently thinking about what those amenities are, trying to figure out what would be best use of resources and would best benefit the community. And we invest and we build these beautiful community spaces, and then we limit access to them and make people feel like it's really not an extension of their home. So that came up over and over again, as Sandra said, in terms of thinking about the community building, in terms of sense of safety and control over their lives. We also talked to residents about data collection. All of us do some form of data collection. Certainly we do compliance data, and for those of us that are doing resident services initiatives, we're doing various kinds of surveys and resident satisfaction. We wanted to get a sense of how they felt about the collection of that data and what might be a way to engage with them about it differently. Generally, the sense was they weren't so concerned about giving information, sharing data. They wanted better communication, and they wanted to understand better why the data is being collected and how it's being used. Like all of us, we talked about different mechanisms for sharing information, and they want choice. They want different opportunities and interactions to learn about the data and to learn about why it's being used. And, throughout all of these conversations, the communication issues kept coming up as being the most significant challenge in all of this.
Residents also expressed a sense of obligation. So they felt like because they're living in subsidized apartments, that there was an expectation for data collection and less expectation for privacy. So that's not to say that they were okay with it. They just felt like that was part of the deal in living in a subsidized home, which is interesting for us to consider, and allows us to think a little bit harder about being more thoughtful when we gather this data and the types of questions we ask residents.
And consistently, residents in all 3 sites and all of the focus groups, at the end, when we came to the end of the focus group, they all asked, said, this was great. When are we going to get to do this again? You know, there was a desire for continued engagement. They expressed in some of the discussion and the importance of having shared values in a property and a community, acknowledging that there is significant diversity and diversity of opinion, but that having platforms and forums for this kind of engagement is important, and that they wanted to have more of these, more opportunities to talk about their community and about what's important to them. So the actual act of just having these focus groups was valuable, not just for us, but for the residents that participated.
So when asked to define resident engagement, what we found is that most staff, and we're starting the learnings that come from our staff interviews, focused on, when asked about resident engagement, they tend to relay that in terms of participation in events, rather than discussing ways to engage residents in decision-making or creating things that would allow them to build relationships, community, and trust. I think, it was clear to us that engagement almost had an information gathering component to it, because it allowed folks, or the resident services staff and property managers, to determine, what programs would be best to offer, what residents are interested in, which is critically important. We don't want to diminish that importance, but I think that what that means is that you're not really including residents in more of a collective process beyond just, what event can we hold in the community room.
And the other, related to that, all staff felt that they were accessible and approachable. We all think that we're great at our jobs. We all probably are good at our jobs, but the perspective that, it didn't align with what we were always hearing in the focus groups. And there was across the spectrum of staff we talked to, there was a variety of, some staff had more training around engagement and customer service, trauma-informed strategies than others. Regardless of the level of training and sort of competency and familiarity with some of those strategies, everybody felt that they were very approachable and accessible. So it's just something to think about in terms of where we see some of the gaps in perspectives between residents and staff.
And I think regardless of how much residents were incorporated at the various properties, far and away, for the most part, staff felt like including them in whatever decision-making was already happening and program decisions does help them to be successful in their own work. So it assists the staff with completing the tasks that they need to do to, make residents feel as they are part of the community as they're offering at the time, and also grounding the staff person's work in actual meaning, which is very important.
And then some staff question the value and the practicality of being able to do more power sharing with residents. And, the challenge of implementing a really pretty radically different approach, there was the potential, frequently talking to resident services staff, that there was greater alignment, at least at the surface, but we heard staff, both property management and resident services, talk about how significant a cultural and operational shift this could be, to really look at not just the programming efforts, but some of the procedural and operational questions that came up with this.
And then as far as data collection from the staff's perspective, they felt that especially long-term residents already understood why data was collected and essentially assumed that data collection is just an accepted norm. However, as we iterated already, when residents in the focus groups did mention, while they are not surprised when they're asked for data information from them, there were times when they did not always understand why particular data is collected and would appreciate more explanation, more clarity, and communications on why that was occurring.
And staff saw data collection as an opportunity to build trust when they, especially with the resident outcome surveys or resident satisfaction surveys in the places where they were doing it. They saw the data collection as a way to build rapport, to engage with residents, to communicate the value of resident services or other kinds of program and amenity offerings. But when we asked how that data gets shared back, once they've collected it, most staff didn't have a process for sharing it back. A lot of that stemmed from not understanding what was valuable to residents and how to think about sharing it in a de-identified way.
And on top of that, most data collection was for compliance and tracking resident outcomes, not so much about resident satisfaction as an engaged member of the community. I think it's very different to ask a resident's opinion on whatever program we did on, computer literacy or what have you in a particular day. Like that type of feedback that you ask folks is highly different from just asking overall, what are ways that this property, it could become more of a home? How could we incorporate your voice more clearly? Those are two very different things to ask residents about, and that was clear. We also found that there was a little bit of a disconnect between frontline staff and what senior staff thought about why data is collected and how it could be used. I think from a senior staff perspective, granted they're not on the ground day to day working with residents, we did see a little bit more of an aspirational desire for how data could be used at a given time versus those who were on the ground.
And as I was saying a little bit earlier, of the staff who participated in trauma-informed trainings, almost all of them saw a value and a benefit and desired to continue it. There was also conversation that came up in all levels of our engagement in the resident focus groups, in the interviews with frontline staff, and with some senior level staff to talk about opportunities for other kinds of training, not just resident services staff, but trainings along with residents, trainings with your property management and maintenance staff. And to think about how that plays out in the property operations and in the policies, not just in the daily interactions we have with residents.
So I want to highlight how, the concept of resident voice and agency folds into the context of the current COVID-19 pandemic. There's lots of research out there, including research conducted by Dr. Megan Sandell and some colleagues that was published in the Journal of Pediatrics in 2018, that the stress residents can experience from not being able to pay rent on time, or that constant concern about, are we going to be able to make rent, can have the same negative health outcomes as families that experienced homelessness during the study period or potential displacement. That stress can linger whether you're able to make the rent or not. So if you think about it, you have a resident who may be worried several days, are we going to make it? They do make it, but it takes a while for that flight or fight response that all of us have as human beings when we experience chronic stressors to really temper down. And the physical impacts can be long-term. There is a high correlation between physical symptoms to mental stress. And so it's really important that we engage in a conversation about how we request rent from residents in light of COVID in a way that is non-threatening. And I think the other thing too that we should keep in mind is what has occurred as a result of COVID, the loss that people have experienced, whether physically or financially, is akin to what we've seen in other natural and man-made disasters. And there's a lot of research, post-disaster research, that indicates that social and community disruption, financial stress, and loss after a disaster are not the only things that such individuals experience, but it also leaves them susceptible to PSTD. So that is something to keep in mind. So we at SAHF created back in April a blog post and a communications tip sheet about how to speak with residents in light of the circumstances, in terms of creating a rent plan with them down the road, especially once that relief is lifted later in the summer, to make sure that we can keep folks stably housed. And I think overall, as COVID continues and the expectation of a second wave or beyond of infections that are certainly possible given that we do not have a vaccine for COVID at the moment, I think owners are faced with the challenge of the balance between, you want to protect the physical health of all the community members as well as supporting agency and autonomy. And so how do we best do that? And those are things we're very much considering as we move forward in this work. And the last SAFE slide we promise is, next steps for us is really finalizing the analysis and integrating, all of the pieces in a much more succinct level, and think about how we incorporate those strategies into our framework for resident services coordination. And as I mentioned before, how can we better integrate either trauma-informed or resident-informed strategies into the overall affordable housing field in all aspects: development, property operations, asset management, and resident services. And we want to continue to lift these models up and learnings to push the field forward, because we feel like this is critical to supporting resident stability, health, and well-being. And may even consider looking at, in the future, policy and regulatory barriers, and how we could dismantle some of those barriers to move this approach forward. And with that, I will pass it on to our colleague Elizabeth from Community Builders.
Thank you, Sandra. So placing resident experience, agency, and opportunity at the center of all we do is one of TCB's strategic priorities. Next slide, please. Next slide.
Yep.
So as an owner, manager, and provider of resident services for 10,000 families and 3,000 seniors across 14 states and 30 cities, we strongly believe that we need to place resident at the center of all we do to accomplish our mission. Our mission is to build and sustain strong communities where all people can thrive. Now, we know that for people to thrive, they need a sense of agency, control over their life. We also know, and Sandra and Alessandra reviewed the evidence for us, that when people have a higher perceived control over their lives, trauma and stress decrease, and feeling value in the community increase. So how do we operationalize putting residents at the center of all we do? Let me share a model that we are developing for a community we have in Worcester, Massachusetts, involving 650 households. Next slide. So let me just share this model where we place resident housing stability at the center, because for our residents, having a stable and healthy place to call home is the start of feeling in control over their lives. And I think some of you already identified this, being able to pay your rent, being able to be stable in your home is the beginning. For us, it's the platform to have a sense of agency and control. It is the platform to increase the perceived control and decrease trauma and stress. Also, we know that when our residents' level of daily stress and trauma is low, housing stability is higher, feeling value in the community increases, and as a result, residents' economic mobility increases as well. So we call this model a trauma-informed housing because we focus on what we as landlords can change. Call it our practices, our housing rules, our housing policies. We need to change our practice in a way that resident agency is enhanced. Let me tell you more about this model. Next. Specifically in this model, the primary objective of trauma-informed housing is to promote agency, control, safety, trustworthiness, transparency, collaboration, and empowerment among our residents. Now, these are themes that came up from the focus group we ran last year with our residents. In this focus group, residents voiced clearly that they wanted to work with us in developing, for example, housing rules, which will be affecting them directly. So let me give you a specific example. They talk about allowing them, the residents, to participate, collaborate with us in decision-making, deciding, for example, how a community room will be used, the time of operation, the type of activities that we'll bring. These activities that seem minor but extremely important for our residents increases the sense of agency and control, empowerment, feeling value. This is an example of how TCV places resident at the center of all we do. Next. So what are we doing next? We have this multi-pronged approach and we are focusing on 5 areas. You have mentioned is the staff training, that trauma-informed training. And this is not only for community life, which is the resident services. This is also for property management and key community partners. What is the goal of this training? We want to increase our staff responsiveness to resident needs. And we want to develop the shared understanding of the trauma-informed practices. We are currently identifying resident leaders, health champions, we call them health champions, recruiting them and training them to be part of the solution, to help us identify, support, and connect residents that are at risk of housing instability to local resources. And we call it not only they are local, but they are appropriate and culturally responsive resources. We want to increase our knowledge and the network of those resources. We want to, and we are doing this currently, enhance our efforts to build social connections and social trust among residents and between residents and staff. So not only we want to increase the spaces and make them trauma-informed spaces, but we want to make sure that the social activities are done in a way that is respectful of resident choices. So we like to think about residents are engaged if they are attending our events. And sometimes we penalize them in a sense that we give them the, kind of a face when they come and say, oh, you didn't come to the event. So we want to make sure that residents have the choice of which events they are going to participate and which no. Social events are there for them. The spaces are there for them, but they choose how to use that spaces and how and when. Lastly, very important, we are in this process of reviewing and addressing policies and structures that without meaning are really exacerbating our residents' trauma and decrease sense of agency and control. We want to do that in collaboration with our residents. We want to review those policies and those rules with that lens. And we're going to incorporate and structure and change those policies. this is an example of how we are placing residents at the center of all we do. And we don't have more time, and I want to be respectful of time, so we have time for Q&A. Thank you.
Great. Thank you. So I am trying to look at the chat, see what questions we have.
Thank you, Sandra.
Sorry, I don't know if we, I think we shared with folks, we had a little bit of technical difficulty getting in the presenters. And so I'm essentially the only presenter not on my cell phone. So trying to do my best.
I know there are a lot of questions about slides. There are slides posted. We will make sure that they are complete. We will share the link for our blog and the communications tip sheets. We'll make all of that available.
So quick question about the gathering of the data. For the focus groups, we're not trained focus group facilitators, SAHF staff that attended, but we partnered with Success Measures and their evaluation team. And so they assisted us with creating what we asked in said focus groups with a lot of our input. And we were present, but those focus groups were strictly run by Success Measures. For the interviews, we again collaborated with Success Measures on what we would ask both the frontline staff and leadership level, corporate level folks, but those interviews were conducted solely by SAHF staff. So if the person asking that was wondering, you know, were we getting the best answers because we're not a neutral person asking, you know, that could be a limitation of our research methodology for sure. I am looking, I'm seeing all the great reasons why people are in here.
There is a good question here about, you know, how we ensure that we get a well-represented voice from all residents, because, you know, we tend to have the same residents coming to the meetings, and that's good. I mean, that's exactly right. That is a challenge. And the one thing that we have found most helpful is when you have the trusted residents, what we call the health champion, going into the community. So these are residents and really meeting residents throughout different venues. That's how you can get maybe more of the voice. But I think that what we are finding is the more you do this, the more trust you build, the more residents you'll get the voice, the more you will hear from more residents, and especially when you start, they start understanding that what they say matters. Their voice does, you know, make a difference. That's when I think you get most of the responses. But the resident leaders are very helpful in gathering data informally across the developments.
Mm-hmm.
I would say that it was something we thought a lot about as we were creating our protocol, talking with Success Measures, talking with the members that participated, and because we were relying on staff to help us do recruiting. So we ran into that challenge of that, you know, potential bias in who was showing up. So we know that we got a lot of, you know, the residents that show up for everything. I was also surprised at how many residents, when we went around and did introductions, you know, said, this is my first event. This is the first thing that I've attended because this was different. I can't say why that happened. I mean, we talked about, we created flyers, it was translated. We had in properties where we had identified it, we had a translator on site. We did offer a stipend for participation, but there was not a, you know, that is a potential bias and a challenge in our methodology that we were aware of. But I agree with Elizabeth that as we continue down this path of doing more of these and resident leaders, you know, talk about it and feel more engaged and feel that relationship and trust is built, you'll start to draw greater numbers of residents and different people, different faces, different voices.
There was a great question in here that's actually for the audience and I think highly relevant, knowing that this is a CLPHA event. How are other public housing authorities applying resident agency and trauma-informed principles and approaches with voucher households. And so any tangible examples would be great. And so I'm seeing some of y'all in the chat have shared Columbus Metro Housing Authority is one example. And I'm curious if others, I don't know if we want to be brave and allow, where's our tech support? If we should allow people to unmute their mic to share how they're implementing some of these approaches.
Sure, I can definitely allow people to unmute themselves.
Okay, I think let's do that. I think that's a pretty important question, and I want to give y'all the ability to.
Any brave souls out there? So I will say, as people are thinking about it, from SAHF's perspective, because we are a collaborative of nonprofit owners of affordable housing, this question has come up from the other side as, we house, in addition to our project-based subsidies, we house many voucher holders, and thinking about how do we partner with housing authorities and how do we support voucher holders together. And the housing authority thinks about the voucher holder as their resident and their tenant, as do the private owners. And so I think that there's some opportunity here to think about this differently and do a better job of coordinating, and especially around some of these strategies as well. I don't have a specific example of that, but I think as we are all headed down this work, this is a clear nexus and an opportunity for that.
Mm-hmm. There's another great comment here about trauma-informed approaches, and just saying that it's necessary at every housing authority, including mental health resources for the employees and residents. Thank you for sharing that.
Yeah. And so we had these grandiose hopes to put everybody in breakout groups to really discuss some of these prompts. Obviously, we were aware, even without the technical glitches that kind of inhibited us starting on time, that we wouldn't get through all of them. But I think these are the questions, we're definitely continuing to ask ourselves. We know our SAHF members, like Elizabeth indicated, are constantly asking themselves. And we're wondering, based on these prompts, and you can reply in the chat, or if you feel like being really brave, we welcome you to unmute your mic and just share in response to any of these questions in the next few minutes, and then we'll definitely wrap up.
The other thing I would say is, so Steve, before he had to jump off to get ready for the closeout session, he tossed the idea to us privately of, given so many of the CLPHA members beginning or further along in doing this work, and SAHF members, that this might be an opportunity where we organize another Zoom meeting and discussion later this summer to pick up on some of this, and that some of the CLPHA members and the SAHF members could have a bigger discussion about some of these themes and how we see, where we're learning from one another, where we can see the opportunity to collaborate on some of it as well. So if people are still, I know people are starting to leave to go to the other session, but if that's something that's interesting to you, let us know. Give a thumbs up or a yes in the chat.
Yeah.
So maybe we can also put, as people are leaving, we have our contact information. We welcome everybody we thank you all for joining us, and we want you to all stay in touch if you have questions about anything here, or to continue the conversation later.
Absolutely. Thank you for spending time with us this afternoon, and please stay in touch.
Thank you so much.
Thanks, everyone.
Thank you.
Well, no, it was just a great presentation, and there was a couple pieces if we do have another discussion. I mean, you touched on so many things that were important to our work, but the piece there's a number of things that resonated, but the idea of how common spaces not just are used, but how easy or not they are for residents to use them.
Yeah.
I often see beautiful common spaces that sit empty, and I always wonder why that is, and I think you might have tapped on part of what it is like, if you don't feel like it's yours to use, you're not going to use it, no matter how
Right.
it is.
Right. And it's an area of tension because the owners are getting different guidance on the liability and the insurance, and if you have staff on site, and sometimes that's coming from a sort of higher level guidance within the organization, sometimes that's something that the property manager is making a choice about for whatever the reasons, and it doesn't understand sort of the other implications of that. So yeah, I think there's a lot there, and it came up. I mean, it was such in every conversation just kept coming up in, as Sandra had said, it was around, the communal spaces of cooking and celebration and food distribution, and both around being able to organize that on their own and access it, but also that it was your eyes in the community frequently in the outdoor spaces, and both connecting with people, safety, all of it. It touched so many different threads of what we take for granted in our home.
Yeah.
Yeah, we were curious too. Like, I can definitely appreciate, like, if it feels as if you have to ask permission to use it. I don't know if this came up at all in yours. We were curious too about the design and placement of those spaces, if there was anything about design considerations that really encouraged people to use it, to linger, to get to know other residents and have that sort of like that social connection and, reciprocity. So I don't know if that came up in your work at all, but we've been fascinated by that.
It didn't come up explicitly, with the exception of a few of the properties where we did focus groups had undergone a remodel a few years prior. And so there was feedback from the residents about like moving. So maybe there was, a set of grills at 3 different points in a garden style property. And then all of a sudden it was reduced to 2. And so some of the residents talked about having to, walk all the way across the parking lot to go, do that. And it was clear that like they were not included on the design plan in terms of, eliminating an extra grill and all that sort of thing. I will say that in a parallel body of work at SAHF, we are exploring equity-driven and trauma-informed design spaces. And so that will have more of a design element, like architecture component to it. We're having a couple of guest architects come to speak about that and about how a space is activated, like how the design can activate engagement and vice versa. But I can't speak, explicitly on these particular properties, whether that was even incorporated at the beginning or not in their remodels.
And I think in our update to the framework, even though it sits in the resident services space, part of those early steps are ideally happening in the pre-development stages. So, it's not just engaging the residents to the extent that you're able to about what they'd like programmatically in terms of services and supports, but there's obviously an intersection there with how that interplays with the physical design of the property. And a lot of groups do this, but frequently that's when it drops. But, to really provide a different kind of listening and collaboration on thinking about space differently.
And Kim, do you mind sharing where you work or who you represent?
Oh, not at all. I'm talking to you from Austin, Texas, and I work with a foundation, the St. David's Foundation.
Oh, excellent.
And we have did a line around supported housing. And recently, we're about in our second year of doing an RFP that actually resident voice, choice, and engagement was one of sort of the goals of that RFP, as how do you use space to foster social connection.
Yeah.
And so this is all super relevant. And it's hard and tricky stuff. And the measurement piece is one that I know a lot of our grant partners are really asking us, like, how do you want us to measure whether we're doing this? And we're like, we don't really know. Like, we have common sense things, but none of them that are really easy. Like, one of the things that it's interesting we've been saying is, like, if residents know and trust one another, that's probably a good sign that you're doing something right. Like, what percentage would feel comfortable to have a neighbor in that property that they would call for a meaningful favor, like a ride to the airport, watching their kids for an hour. But that requires a lot of effort to get that data. So, any thoughts that you guys have on, like, how do you measure when this is looking good? Like, other than just housing stability?
So that's an area that we have been engaged deeply with our members and exploring and talking to other externals. We don't have a full list. I mean, it's an exhaustive list, but there is no one or even 6 measures. These are all proxies, and our members are trying out different things. I think the question around knowing and trusting your neighbors and feeling safe in your home versus in your neighborhood, those are 2 different questions, are frequently used. They're certainly in the senior space, it looks a little different. There's a lot of focus around senior isolation as one of the proxies for thinking about it. You know, people are looking at voter enrollment or voter registration and participation. So I think the goal would be, you know, as we get further into this, to continue to put together sort of a list of possible measures. Independent of this project, SAHF does an outcomes initiative where our members collect data and we aggregate it across 5 different impact areas. One of those impact areas has historically been called resident engagement, which talks about around some of these things. And I think where we'd like to see this go is that on the other side of this, we come together as a collaborative again and look at those and decide, you know, each group is going to pick different measures that make sense to measure its, you know, specific properties or communities or their part of their portfolio. Which things would we want to think about aggregating up in the SAFE portfolio and or recommending to somebody as, you know, for consideration. And I think we will likely revisit that in the next year.
Thank you.
Yeah. Thank you.
Thank you very much.
Fantastic presentation.
So glad you could join us.